Is it psychosomatic? Is
Yeah,
it
yeah, yeah.
like when you
Like
feel it in your body?
the physical feelings that you
Yes.
came.
Yes.
Fear can be manifested in many ways, right? It could be manifested physically, it could be manifested mentally. So it sounds like you felt maybe the panic sensations,
Yes,
the heart
exactly. So,
race changing, the breathing changing. How did you experience it?
yes,
Yeah. Hmm.
exactly. So what I felt most was like the psychosomatic response.
Okay.
Um, my heart rate was always and continues to be through the roof. Like I
Okay.
can be sitting there doing absolutely nothing and my heart is beating at like 172 beats per minute, which
Jeez. Yeah.
is very
Hmm.
high. Um I suffered severely from like gastrointestinal things. That was the nausea, the vomiting, the like not being able to eat because
Hmm.
you just don't have an appetite because you are so anxious from the thoughts that you're having. I think that was the most real for me. And I think that was hard to grasp because OCD is something that happens up here, but I was feeling it in the rest of my body.
I am thrilled we're having this conversation because we haven't had many people yet talk on the physical side. We've talked so much in a lot of these podcasts on the emotional piece of it. So this is really, really great. A lot of times people will come into therapy and even think they have panic issues, right? And because if they can't do a compulsion, they have this panic experience. And then if somebody who's doing therapy isn't well educated in OCD and they don't kind of really investigate it to see what's going on, the assumption might be this is just panic when it's so much more. So here you are, you're experiencing all these physical things. What were you doing up until therapy as a way to manage and deal with the physical sensations that you were having?
I wasn't,
Hmm. You were
which
suffering then. You were
I was
suffering.
suffering. I was
Yeah. Okay.
definitely suffering. I had lost a lot of weight because I really wasn't eating.
Sure.
I was always throwing up. My parents were like, "Are you pregnant?" Like, like
Yeah.
what?
Yeah.
Why are you always
Hmm.
throwing up? I'm like, I don't know. I
Hmm.
wish I could tell
Hmm.
you.
Yeah.
Um, I was just suffering. There, I really like. I had gone to thousands of doctors. Just getting checked out, and there was never an answer. Blood tests and everything would always be normal. They were like, "Oh, there's nothing wrong with you." I'm like, "Well, I think there is because I don't feel right." But it was very like, "Oh, there's nothing we can do. Like, you're fine. You're totally fine. There's nothing wrong with you and there's nothing we can do to fix you."
Yeah.
So, once I started managing like the mental aspect of it, I started to notice my physical body like just feeling so much better. I wasn't super nauseous all the time anymore. I will say my heart is still it still beats pretty fast sometimes when I get
Hmm.
anxious, but I
Yeah.
think that that's okay because I'm learning to manage it.
Yep.
I mean, obviously OCD is never going to go away,
No.
but I'm okay with that because I know how to manage it now. And I know that it's there, but I also know that it's not like here to take over my entire life.
And you know that you don't have to believe it now, too, right?
Yes.
Yeah. I'm thrilled to have the physical conversation because
Yeah.
again, not
Yeah.
not a lot of people talk about that. So this is really fun for me because I love doing the physical exposures. So we will do things like have people run in place and hyperventilate, breathe through straws, learn that you can handle the physical sensations because OCD will throw those at you to scare you into doing compulsions and say, boy, look at how dangerous this is. You might die. Right. And then you kind of go from, I don't know if I want to be alive on a train to, but if I don't do the things OCD tells me, I'm going to die because look at all these physical sensations I'm having. And these mimic heart attacks and various other physical experiences. So you were kind of in this damned if you do, damned if you don't stuck point for a while there, weren't
Yes.
you? Yeah.
Yes.
So you go to all these doctors, physicians, specialists, whatever, for the physical things. Like, oh, nothing wrong with that. I mean, we can investigate the physical things all day long, but we ain't touching anything up here because that is off limits whatsoever. But all the other stuff, you can scope me, you can blood draw, you can prod and poke and do whatever to figure out what's going on. Just don't touch up here whatsoever. How do you look back at that now? And part two of that, what are your thoughts about than all the medical appointments that you went through. And maybe nobody actually asking you about anxiety or anything.
Yeah, that is the first thing that I would have responded to that is that nobody ever asked me.
Mhm.
And I think that that's super important because I think that a lot of people go through that where nobody's asking them. And it's like, if no one's asking me, how would I know?
Yeah.
Especially if I don't have a background in psychology or, I mean, I have a background in education, so I did have some psychology in there, but to somebody who did not study that at all, it's like they probably wouldn't even think to be like, oh, well, maybe, something's going on up here. So I would hope that, you know, in the future and just doctors, people who are becoming doctors today and are dealing with physical ailments, I would hope that they make it part of their routine to ask about mental health as well.
Yeah. It's one of the things that I enjoy most about my job. I'm talking about me for 1 second here, but it's one of the things that I really
Please do.
enjoy is I get now to work with other providers who work with NOCD, and I get to go on either virtually or in person to prescribers, and I get to educate them about OCD and tell them about how it appears and what they can look for. And it's amazing how many people say, "Oh, that's OCD. Oh, wow, okay." And the second part is to help them recognize too that the dosage required on medications is more for OCD than it is for, say, depression or something. So we're continuing to push out that education. You today are being a part of that. So thank you for helping us with that too, because I can say it all day, but to have someone who's been through it and who now looking back would have appreciated learning something like that is really great.
Yeah, I'm happy to be a part of it. And I do appreciate that I have the experience myself because I hope that, as a therapist in the future, I'm able to bring that experience into sessions with clients.